That's right, Nompu. You'd recall that the Gauteng Premier David Makhura had basically likened the situation in Gauteng to being like a house on fire. He said he was not going to mislead the citizens of the province in that the situation itself was quite dire. I mean, just looking at the figures that were announced last night in terms of new infections in the country, you're looking at about over 17,000 new infections countrywide. But close to 11,000 of those, Nompu, are new infections in the Gauteng province. So in the next half hour, we're expecting that briefing to get underway at 12:30. We're expecting to hear from the Gauteng Premier exactly how the province plans to move forward. You must recall that they had also indicated that there were not ruling out the possibility of asking the national government for tighter restrictions within the province. So now how that's going to need to happen, Nompu, is that I just heard a bit earlier on the Gauteng Premier David Makhura indicating that these tighter restrictions are not necessarily what you're going to see in terms of a shutdown of the province. That's highly unlikely to happen. But tighter restrictions, perhaps in terms of law enforcement that they're going to have to do. As you indicated, those military medics, of course, that have been brought in are expected to be deployed in the next couple of hours or so. I'm not sure how far that vaccination process of theirs is at the one military hospital, but certainly Gauteng would need to take a different approach now. The situation itself, I don't think I'd be exaggerating if I said, is out of control. So the province itself, we're hearing from quite a number of quarters, Nompu, that while the hospitals themselves are full, the COVID wards are full. We're hearing that some of the patients are being treated on the floor. Now, it's very difficult for us, Nompu, to get into these facilities. You know that security is quite tight. You cannot just walk into your camera. We're really relying on nurses and doctors in these facilities to give us a sense of exactly what's happening within these private and public facilities. But at 12:30 today, we're expecting the Gauteng Premier to give us an update of what they might not necessarily say what exactly they're asking the National Coronavirus Command Council for, but what we do know is that they do want stricter conditions within the Gauteng province as a result of what is taking place. You would also know that what has been a major setback for the province was the closure of the Charlotte Maxeke Hospital. Now, Charlotte Maxeke in April, was closed due to a fire that had taken place there. The oncology unit, where you heard previously as well, cancer patients were struggling to get their medication. The oncology unit was scheduled to reopen. That did not happen. We're expecting an update from him today on when that is going to take place, because the fact that Charlotte Maxeke Academic Hospital has not been operating has been a major setback in terms of the number of beds it has taken away, in terms of how the province would be able to increase its capacity in terms of the number of COVID patients that it can treat. So it'll be very interesting to hear from the Gauteng province this afternoon when exactly the Charlotte Maxeke Hospital is scheduled to reopen. The last explanation that we got was that they wanted to make sure that the structure itself was 100% stable before they could send patients as well as staff into the facility. But the province itself is in a dire situation at the moment. Certainly something needs to give. The Charlotte Maxeke Hospital needs to be operational, I guess, within the premise of safety conditions as well, not just for staff, but also for the patients who would be admitted at that facility. But something needs to happen. The province itself, the Premier himself, indicating that the situation is indeed out of control and something needs to happen. Bringing the military medics, yes, is going to assist in terms of capacity, assisting the staff in the province, or to alleviate the pressure itself as well. But the numbers themselves are going up. The hospitalizations themselves are going up. So how that's going to be dealt with in terms of bed capacity, Charlotte Maxeke is one of those institutions that the Gauteng province would need to make a decision on, and a decision on that very fast. So very interesting to hear what the Gauteng Premier will say at 12:30, and that will be live here on the channel.
One last thing, Chriselda, before I let you go. We are hearing that the President may be having a meeting with the National Coronavirus Command Council. Does that pretty much mean that we may have a so-called family meeting anytime soon?
Well, Nompu, in fact, just a few moments before we went to air, I saw an article that had written exactly that, indicating that the president was meeting with the National Coronavirus Command Council. And in fact, government communications is Pumla Williams, the Director General, categorically denying that on Twitter. Just a few moments ago, she said she was not aware of that meeting. So I will take it at this particular point in terms of what government communications is saying. They're unaware of that meeting at this particular stage. I'm sure if there is further communication pertaining to that, we will hear from them. No indication at this stage when the president will speak. But you must recall yesterday, my colleague Bulelani Philip in Cape Town, attending that press briefing with the president, him also indicating is very concerned about the figures throughout the country and more concerned about the figures in Gauteng. But you can't just take a blanket approach, Nompu, and say you're going to shut down the entire country or you're going to shut down Gauteng. Remember, this is the economic hub. And in an economic hub like Gauteng, you're going to expect a lot of movement to be taking place. So the government really on a tightrope of having to try and balance between making sure that the job losses that we've seen as a result of COVID-19 and many of the other effects that have come along with this global pandemic, you're not going to have a situation where the country itself is not going to be able to recover. However, having said that, they would also need to make sure that they're able to speedily deal with the issue of the high rising number of infections in Gauteng and tighter restrictions, they say, they're not going to shy away from. In what form that will come? Perhaps we'll hear from the Gauteng Premier at 12:30. He'll shed light on that.
Like you say, a very tight rope indeed. Thank you very much, my colleague there, Chriselda Lewis.